My name is Regina Campbell, and I'm a physical therapist, and I own a practice called Performing Arts Physical Therapy. Well, I'm a physical therapist focused on treating musicians, and I got interested in it because I'm an amateur musician myself. I played the piano for years and the saxophone, and I also sang, and it was a great way for me to combine my knowledge as a physical therapist with my sort of passion for music. Well, musicians have quite unique needs compared to some of the other kind of populations that physical therapists work with. For instance, sports athletes or the elderly, and just to name a few of them, musicians don't tend to like to exercise on a regular basis, and they may not have the strength and the dexterity and the endurance that, for instance, sports athletes do. And they also don't get the training in their undergraduate conservatory studies on the anatomy and physiology of how the body works and how that's important to them as performing musicians. And that's one thing that music conservatories are now currently trying to incorporate into their curriculum. In comparison to the dance curriculum, has had this in their programs for years now. Well, I think understanding where the muscles are and where the tendons are and how the joints move and work, and just even having nomenclature for certain things can help them, first of all, describe to a healthcare practitioner when something's bothering them, what exactly it is, and also just understanding how the body works can help them learn to do exercises and warm-ups that are helpful to them as a performing musician. Yes, what I do as a physical therapist is sort of a range of things. I do a lot of injury prevention and wellness talks at local music conservatories and the Boston Symphony Orchestra, just so that I can get at injury prevention from a grassroots level and help people to understand how their body works as they play a musical instrument. But I also do a lot of manual therapy techniques for people who are experiencing pain and some pain modalities. I'm more of a manual therapist than probably using a lot of pain modalities. And then as people recover from the pain they're feeling, then I show them strengthening exercises and endurance training, things that can help them from getting re-injured. Well, I think all instruments can provide risk in terms of injury, and I do see certain injuries that are associated with particular instruments, but I don't think there's really any one instrument that's more dangerous to play or more difficult to play than another. I think that that's been shown with a lot of demographic studies that have been presented here at the PAMA conferences that, for instance, string players are more likely to get ulnar nerve entrapments and thoracic outlet syndrome than some other instrumentalists, but there's injuries across the board, really. Well, singers oftentimes have cervical or TMJ issues, as well as vocal cord strains or nodules. Singers also can get low back pain from the way they stand when they sing, too, if they're standing with too much of an arch in their back, or if they're wearing, some of the women wear heels when they sing, and that kind of throws their posture off. And singers tend to incorporate dance with their music production, obviously more than musicians or instrumental musicians do. So they're moving around oftentimes very quickly on stage if they're a rock or a jazz singer. So that can be good in terms of them not having stagnation issues with their blood, but it can also be bad in terms of just their whole postural stresses on the low back and combining maybe some more neck issues with what they're doing with their singing. Well, for physical therapists who want to specialize in treating musicians, I'd recommend trying to do some sort of mentorship or internship with a physical therapist who's used to seeing that kind of patient, because there's nothing that really can take the place of the observation and just learning the hands-on skills, almost similar to a fellowship or a residency for a physician. But I'd say just really understand what it is to play a musical instrument. That's probably the most important part, because I think for a physical therapist to be able to give a patient a full evaluation, they really need to observe their playing technique or their singing technique, and to really understand what's involved with playing various instruments and what it's like to have to rehearse for hours in a day or a week is an integral part of working with a musician. And then also just learning what some of the specific injuries are that are maybe more prevalent amongst musicians compared to the general orthopedic population would be helpful. And then I think musicians also, in terms of treatment, are more sensory sensitive, if that makes sense. So that a lot of techniques that you may use, for instance, with a football player or a soccer player in terms of deep tissue massage or trigger point massage, most musicians don't respond well to those types of techniques because their sensory systems are so finely tuned that they almost perceive them as noxious stimulus. So there's certain kinds of techniques that work better for musicians compared to other types of patients as well. Yes, in terms of telling somebody to try to cut back on their number of hours that they practice, I use some analogies for sports. So I get my patients to think about, well, if you played soccer or football, for instance, how would your body feel if you played that for 6 to 8 hours a day, every day of the week? Would you still be able to play that sport? And that's, or I use running a lot of as an example. I think those analogies are really helpful to musicians to get them thinking about how they're using their own bodies as musical athletes. And I've also done some talking to some of the music faculty that are colleagues of mine, and they have suggested that the general idea is for the students to be playing about 3 hours a day, whether that's their own individual practice time and rehearsal time. And that's a very hard thing for a lot of conservatory or jazz students to accept, because they feel like the more they play, the better they're going to get. And sometimes it's counterintuitive to think, well, if I keep on playing, I might injure myself and may not necessarily get better. I also get people to think about how the brain works and compare playing a musical instrument to, for instance, studying for a history exam. And I asked them to think about, well, if you were trying to study facts for a history exam, what would happen if you studied for 3 hours straight? Would you really be able to focus and understand and absorb the information as well as you could if you stopped and took a break after about an hour? And I think that's been helpful as well. In terms of young musicians, when different centers have done demographic studies, there's really no difference in injury prevalence for young musicians compared to, for instance, professional musicians. The general prevalence of injury rate is about 85%. So I think it's really important for young musicians to not be pushed by their parents and their teachers to over practice, and their bodies are growing fast, and oftentimes, for instance, piano students who are young students, their hands are small for the instruments. I think it's also very important for teachers of young students to get the students fit for the proper size instruments if they're playing string instruments, or even woodwind or brass instruments, to just make sure that the instrument fits the child properly. And the same thing, that they really should only practice for a couple of hours a day with the practice sessions interspersed by a few hours each.